Hello, dear listener. You are tuned into Wells Radio 89.3 FM, your preferred awesome radio. I'm reaching you live from Wells Broadcasting House along Galafin Avenue, Oluyole Estate, Ibadan. On that note, I welcome you to another episode of The Radio Doctor. This is a show where we dive into the world of medicine, health, and wellness. On this show, we explore medical facts, debunk myths, and empower you with knowledge to live a healthier life. I'm your host, Dr. Tobiloba, and together we'll navigate the fascinating realm of healthcare right here on your favorite radio station, Wells Radio 89.3 FM. And of course, if you have any health concern you would like us to discuss, please reach out to our email wellsradiodoctor@gmail.com or WhatsApp on 091-5499-9893. I take that again. You can reach us on our WhatsApp 091-5499-9893, or you can send us a mail on wellsradiodoctor@gmail.com, and be rest assured that we will properly examine your thoughts and your health concerns. Again, I welcome you to another episode of The Radio Doctor, and I'm your host, Dr. Tobiloba Ojo, also known as Daddy Ojo. Ẹ káàbọ̀ padà sí orí ètò yín, ètò wa Dókítà orí rédíò. Èmi ni ẹni tó máa sọ gbogbo nǹkan tó jẹ mọ́ ìlera yín ni o, nǹkan tó yẹ kẹ́ máa ṣe ni, nǹkan tí ò yẹ kẹ́ máa ṣe ni o. Gbogbo ẹ̀ la máa tọpinpin ní orí ètò Radio Doctor yìí. Àìsí farabalẹ̀ ẹ gbọ́ wa dáadáa kẹ́ bá lè mú gbogbo nǹkan tó ń jẹ mọ́ advice tá à ń fún yín kẹ́ bá lè mú ní kẹ́ lè mú lò kó bá lè jẹ́ kí ó jẹ́ nǹkan tó máa gbé ìlera yín sí ibi tó yẹ kó wà kí àìlera sí jìnnà sí yín. So we'll be discussing something so wonderful on this show today, and it's something that is so vital, it's something that is so important, it's something that many people don't pay attention to. It's something that, as much as you like it, you love to do it, many people don't do it. And what is that in? That's the benefits of medical checkup. The benefits of medical checkup. That's what we'll be discussing in this time. I know you might be listening in the morning, in the afternoon, or at night, because we have listeners all over the world. We have listeners in Cameroon, we have in UK, in US, and other countries. Also, we have in Nigeria as well, in different parts of Nigeria, in Oyo State. We shout out to even the people that listen for all the way from Ogun, from the north, from the east. We want to thank you all for always tuning in to Radio Doctor and always engaging us that, oh, doctor, why not speak about this? Doctor, this issue is what I'm battling with. And thank you so much for always sending your feedbacks to wellsradiodoctor@gmail.com, and also for sending your WhatsApp messages to 091-5499-9893. And be sure that we'll always address your health needs, your health concerns, and we'll place that as a priority. So, talking about the benefits of medical checkup, we'll be discussing it in full details. We'll tell you about what's so important about the medical checkup. What is the role you should play? What is the role the healthcare provider should play? What is the role the government should play? And what are the tests you should consider? And we'll be delving into all this, and it will be an interesting episode. It will be an interesting show today, and just sit back, relax, and take in the information, take in everything. And it's not just about taking it in, note it down and start implementing, because we know that in the tapestry of healthcare, prevention is the most important and potent thread that is weaving the fabric of wellness, resilience, and longevity. There's no way you'll be talking about medicine and you won't be practicing preventive care, because it's even a common saying that prevention is better and cheaper than cure. prevention, everyone knows, is better and cheaper than cure. And just the transformative use of medical checkup is a proactive measure that you will be able to use to safeguard your health, to detect underlying conditions that might be wanting to sprout out, and it will empower you to take charge of your life, to take charge of your well-being. You are not just falling ill, you know what to do but part time because you have a good grasp of what your medical health status is saying. And in this show, we'll delve into the myriad benefits of medical checkup and the indispensable role that individuals, health organizations, and government agencies must play in promoting preventive care. So nǹkan tí mo ń sọ ni pé a ti mọ̀ pé gbogbo nǹkan tó jẹ mọ́ ìlera ara a gbọ́dọ̀ máa dúró kí a wà ní àìlera ká tó máa sọ pé à ń sáré sókè ni o, à ń sáré sódò ni o. Gbogbo nǹkan tó jẹ mọ́ à ń ṣe àyẹ̀wò lóòrèkóòrè òun là ó máa sọ níbẹ̀. Kò tiẹ̀ nídìí kẹ́ fall sick, kò nídìí kẹ́ ṣàìsàn kẹ́ tó lọ rí dókítà yín. Nǹkan tá ti ń sọ ní orí rédíò doctor ni pé kò ń ṣe mo ní ibà, mo ní nìkan ló yẹ kẹ́ ẹ ti máa lọ rí dókítà yín àbí kẹ́ máa lọ sí ilé ìwòsàn. Ẹ lè kọ̀ wo ó dà pé ó ti pẹ́ tí mo ti yẹ ṣúgà mi wò, ó ti pẹ́ tí mo ti yẹ ọ̀rá inú ẹ̀jẹ̀ mi wò. Ẹ jẹ́ ń lọ yẹ̀ wò because gbogbo nǹkan báyìí ó jẹ́ nǹkan tó ń sún wa sí ìlera ara tó dẹ̀ ń sún wa kúrò ní àìlera. So we'll be unveiling the benefits of medical checkup, and the first benefit is that it helps with early detection and prevention of diseases. We know that medical checkup serves as the early warning system that will enable your healthcare providers to detect and address health issues before they escalate into serious conditions, from high blood pressure to diabetes to cancers to heart disease to a lot of early detection of different blood kind of things that are so worrisome, that are just lying low. They are just standing in one corner. One of the easiest and best way to detect them and to quickly intervene to push you back to a state of good health is the benefit, or is the crux of having a medical checkup. We can't say it's only when we fall sick we will be going to clinics, we will be going to diagnostic center. I even tell people that one of the best ways you can optimize your health is once in a year run the necessary health check of all your organ systems. And also, we know that with this health checkup, another benefit, which is the second benefit, is that it gives you the avenue to receive counseling and medical education from your professionals. We know that medical checkups will offer you invaluable opportunities for healthcare providers to engage in preventive counseling, a lot of health education, and they'll be discussing your lifestyle choices, your risk factors, and preventive measures. And this will help you and empower you to make informed decisions and also to adopt healthier behaviors. Thereby, you will be reducing your risk of chronic diseases. You must know that it's not until you are ill you will start saying you are not meant to take too much sugar, you are not meant to take too much starchy food. As much as the early medical checkup is concerned, it starts saying that you are already tilting towards this aspect. Why not adjust this part of your lifestyle? Oh, if you drink, please cut down on drinking. If you smoke, can you quit? Can they work you on an addiction clinic that will take you off drinking, that will take you off smoking? All these are also benefits. So the first benefit, as I said earlier, is you detect illnesses and you are able to intervene early. The second one is that you get quality health information, quality counseling about your current health status, and you will be able to know what to do. Then let's now say, for example, you already have a chronic disease. what is also another benefit that a sequential and a constant and even a kind of medical checkup that is consistent? What does this do for you? It helps you to monitor and to effectively manage these chronic conditions. Example, if you are living with chronic conditions like diabetes, chronic conditions like hypertension, or you have asthma, regular checkup are essential for monitoring this disease progression. Is it worsening? Is it getting better? Is it stable? Regular medical checkup will help you to know how you can adjust your treatment plan by your doctors, by your healthcare professionals, how you can prevent complications, and through routine assessment and laboratory tests, healthcare providers can optimize your disease management. For example, if you have high blood pressure and is not well controlled, the only way you can better control it is by doing a routine blood pressure monitoring. Don't just leave it to chance. Don't just say, oh, I pray I will get well. Oh, I pray everything will work. Yes, it's good to pray. Yes, but it's also good to be proactive. So I'm asking you, dear guest, dear listener, are you listening to your body? Are you monitoring your blood pressure? When last have you taken your blood sugar? When last have you done a comprehensive annual screening? Yes, let me pause and let that sink in. When last have you done that? Okay, I guess the answer is best answered by you. And we'll be moving to the fourth benefit, and that is the holistic health assessment. We've known that medical checkup provide a comprehensive assessment of individuals' physical, mental, emotional well-being. And beyond physical examinations and laboratory tests, providers can also inquire about your lifestyle, about your mental health. We do something they call depression screening, where we ask you some questions or ask you to fill a questionnaire, and we can say that is this person tilting towards depression or not. There are also some little things we do to assess your mental health. We call it mini mental state examination. We do that to assess that is something really wrong in the psyche, or is the person just worried, is the person stressed, is the person anxious. And the only way we can address all these issues that can pile up or cause early death or any form of morbidity, a form of ill health, is that we assess all these things holistically. We look at it. We don't just look at the physical health. We look at your mental and your emotional well-being too. And what best way can you do this is by going to the clinic and getting a comprehensive health check. So when you've been able to do all this, it now gives you this fifth benefit. It gives you peace of mind and reassurance, because in addition to detecting the health issues, the medical checkups, all those things you are doing about your health status, by addressing concerns, by answering questions, by providing personalized guidance, the health providers will alleviate your anxiety and empower you with proactive steps to manage your health. So nǹkan tí mò ń sọ ni pé oríṣiríṣi nǹkan ni táwa ń ṣe àyẹ̀wò lóòrèkóòrè fún ara wa. Yes, oríṣiríṣi ọ̀nà ni ó fi ń gbà tó fi ń sún wa sí ìlera ara, tó sì fi ń mú wa kúrò ní àìlera àbí àìsàn. Ìkíní ni pé ó máa ń jẹ́ kí a tètè rí nǹkan tó ti fẹ́ bẹ̀rẹ̀ gẹ́gẹ́ bí àìlera ara. Tá bá rí pé èèyàn lọ clinic nsìn, wọ́n á sọ pé wọ́n yẹ ìfúnpá ẹ̀ wò. Tó bá ti yẹ ìfúnpá ẹ̀ wò, wọ́n á yọ ṣúgà ẹ̀ wò. Tó bá ti yẹ ṣúgà ẹ̀ wò, wọ́n tún lè check ọ̀rá inú ẹ̀jẹ̀. Wọ́n á tẹ̀ níkùn. Ibi bí ń dùn mí o, ibi bí ń dùn mí o. Wọ́n á tiẹ̀ kọ́kọ́ wò pé báwo ni ara ṣe wà tí ẹnìyẹn ṣe wọnú hospital, bí ẹnìyẹn ṣe wọnú ilé ìwòsàn. Kí ni current health status? Kí ni ìlera ara ẹ̀? Kí ló ń sọ ní lọ́wọ́lọ́wọ́ báyìí? ìyẹn ni à ń pè ní early detection. Tá bá dẹ̀ ti tètè rí pé eléyìí ti fẹ́ máa yíwọ́ o, nǹkan tá a máa ṣe ni pé a máa tètè gbé ìgbésẹ̀ láti fún wọn ní ìtọ́jú tó péye, ìyẹn là ń pè ní intervention. Tá bá ti ṣe léyìí tán, a máa ń pè nǹkan ní preventive counseling and education. A máa sọ fẹ́ni pé ó ti lo oògùn ẹ o, ṣọ́ra fún eléyìí o, ṣọ́ra fún ṣúgà o, ṣọ́ra fún yọ̀ o, ṣọ́ra fún oúnjẹ tó wúwo jù lálẹ́ o, ẹ má jẹun tó bá ti kọjá 7:30 àbí 8, tó bá ti ń tó aago 8:30 àbí aago 8 àbí aago 7:30, kò nídìí kẹ́ jẹun mọ́, ẹ lè mọ́mí. Irú nǹkan bẹ́ẹ̀ yẹn là ń pè ní preventive counseling. Because táwa ń treat tẹ́ ẹ̀ wá mú àwọn ìgbésí ayé kan kúrò tí kò múnádóko tó, tí ò sún yín sí ìlera, á kàn jẹ́ pé gbogbo ìgbà nǹkan kan náà lè yàn án tọ́jú ní gbogbo ìgbà. Èyí kò sì yẹ kó rí bẹ́ẹ̀. Nǹkan tí táwa ń ṣe check up lóòrèkóòrè, táwa ń yẹ ìlera ara wa wò pẹ̀lú gbogbo test lóòrèkóòrè, nǹkan tó tún máa ń ṣe fún wa ni pé ó máa ń jẹ́ ká mọ̀ pé ok, ẹni yìí ti ní ìtọ̀ ṣúgà. Báwo ni ṣúgà ẹ̀ ṣe wà lọ́wọ́lọ́wọ́ báyìí? Ṣé gbogbo oògùn tó ń lò ṣó ń lò dáadáa? Ṣé oògùn tó ń lò, even though tó ń lò dáadáa, ṣé ó ń ṣiṣẹ́ dáadáa ní ara ẹ̀? Because mi ní fẹ́ jẹ́ kẹ́ wò pé gbogbo oògùn ló máa ń ṣiṣẹ́. Kò ń ṣe gbogbo oògùn ló máa ń bá àwọn èèyàn lára mu. But tí dókítà yín wá ti wò pé oògùn báyìí wọ́n kọ fún yín, ó bá yín lára mu, òun wọ́n máa maintain yín lé lórí. But nǹkan tí Táyé lò ó lè máa ṣiṣẹ́ dáadáa fún Kẹ́hìndé, because oríṣiríṣi factor, oríṣiríṣi nǹkan tó wà lára ló máa ń react pẹ̀lú àwọn oògùn yẹn ní ọ̀nà kan tàbí òmíràn. Ẹ lè rí pé èèyàn kan á sọ pé orí fífọ́, wọ́n jẹ́kẹ̀ ìfúnpá ga. Èèyàn míì á sọ orí fífọ́, wọ́n á sọ pé ojú, glasses ló need. Ṣé rí pé orí fífọ́ ọ̀nà méjì ló tún pín síbẹ̀ yẹn? Bẹ́ẹ̀ dẹ̀ ni gbogbo àìsàn àbí ìlera àbí nǹkan tí ó lè máa pààyàn láyà pé nǹkan yìí lélelélelele, oríṣiríṣi ọ̀nà, oríṣiríṣi ìtọ́jú ni àwọn akọ́ṣẹ́mọṣẹ́ dókítà òyìnbó àti àwọn onímọ̀ ìṣègùn òyìnbó yóò máa ṣe láti rí i pé gbogbo nǹkan tó jẹ mọ́ monitoring ni o àbí management nǹkan tí ó ti gùn wípé wọ́n ń wò ó, ṣé ó ń control dáadáa? Ṣé ìfúnpá yẹn ò lè di pé ó ń sọ̀yàn di aláàbọ̀ ara, èèyàn ní stroke? Gbogbo eléyìí ni téèyàn wá ń lọ fún test, téèyàn wá ń lọ fún check up lóòrèkóòrè yóò máa ṣe fún wa. A ó sì rí i pé gbogbo kinní yìí a lè so papọ̀ mọ́ yí pé àgọ́ ara nìkan kọ́ ni à ń check o, à ń check ìlera ọpọlọ, à ń check ìlera agbègbè wa, ṣé agbègbè wa mọ́ tónítóní. Gbogbo irú question yẹn ni àwọn elétò ìlera yóò máa béèrè lọ́wọ́ yín láti rí i pé lóòótọ́ ìlera ara yín ó jẹ yín lógún, ó sì jẹ́ nǹkan tẹ́ mú ní ọ̀kúnkúndùn. A sì rí i pé gbogbo kinní ìtún àti sọ fún wa tán, ara wa máa ń balẹ̀ pé gbogbo nǹkan tí mo rò bí ó le, àṣé kò le tó báyìí. A sì rí i pé tá a bá mú gbogbo kinní yìí lò, yóò ṣe wa ní oore tó pọ̀, yóò sì jẹ́ ká wà ní ìlera ara, yóò sì jẹ́ kí inú wa máa dùn pé gbogbo nǹkan tí mo rò bí ó le, àṣé oògùn yìí ó lè mú gbogbo ẹ̀ kó sọ̀kalẹ̀, ó lè mú gbogbo ẹ̀ kó wà ní bó ṣe yẹ kó wà. So gbogbo nǹkan yìí ni àwọn benefits, àwọn nǹkan tí ìlera ara yóò máa ṣe fún ara wa. So I'll be going on a short musical break now, just for you to take in the benefits. And when we come back, we'll be discussing what are the tests you should do at least once in a year. And what are these tests, and what do these tests tell you about your body? Yes, what do these tests tell you about your body? And we'll be wrapping it up with As an individual, what should you do? As a healthcare provider, what should you do? As health organizations, what are they expected to do? And also the government, what are the policies they should be putting in place to make sure we promote our health as a society? Because a healthy society is indeed a wealthy society. Don't touch that dial. You are still on Wells Radio 89.3 FM. Ẹ káàbọ̀ padà sí Wells Radio Doctor, tí a ti ń sọ̀rọ̀ nípa ìlera ara yín, tá a ti ń sọ̀rọ̀ nípa gbogbo nǹkan tó jẹ mọ́ health check-up, medical check-up, àbí nǹkan tá à ń pè ní àyẹ̀wò ara lóòrèkóòrè. A ti sọ̀rọ̀ ní ọ̀sán yìí, a ti sọ̀rọ̀ nípa gbogbo nǹkan tó jẹ mọ́ nǹkan tí health check-up àbí nǹkan tá à ń pè ní àyẹ̀wò lóòrèkóòrè ń ṣe fún wa. A ti rí pé ó ń jẹ́ ká tètè rí gbogbo nǹkan tó fẹ́ máa jẹyọ gẹ́gẹ́ bí àìlera ara, ká sì tètè ṣe ìtọ́jú wọn. A sì rí pé ó ń jẹ́ kí àwọn elétò ààbò, àwọn elétò ìlera kán lè sọ fún yín pé nǹkan báyìí ni kẹ́ ṣe o, nǹkan báyìí ni yóò túbọ̀ sún yín sí ìlera ara. A sì rí pé nǹkan báyìí náà ó sì máa ń jẹ́ ká rí pé gbogbo nǹkan tó jẹ mọ́ àìsàn tó ń lọ, táwọn olóyìnbó máa ń pè ní chronic illness, àìsàn bí ìfúnpá tó jẹ́ pé èèyàn kàn máa lògùn, àbí àìsàn bí ìtọ̀ ṣúgà tó jẹ́ pé ojoojúmọ́ lèèyàn lògùn. Ó máa ń jẹ́ ká lè ṣe pé ok, oògùn yìí ó ń ṣiṣẹ́ dáadáa, oògùn yìí kò ṣiṣẹ́ dáadáa o. Bóyá ara èèyàn kọ́ ni àbí èèyàn ò lò dáadáa, èèyàn á sì rí pé báyìí ló yẹ kẹ́ ṣe máa lò ó, báyìí ló yẹ kẹ́ ṣe máa lò ó sí gbogbo ara. Because òótọ́ ọ̀rọ̀ ni pé àwọn tó ní ìtọ̀ ṣúgà wọ́n sì ń gbé ìgbé ayé àlàáfíà. Àwọn tó ní ìtọ̀ ṣúgà wọ́n sì ń di 100 ọdún. So kò mean pé téèyàn wá ní ìtọ̀ ṣúgà bí ìfúnpá gíga, èèyàn ò lè di ọjọ́ ogbó, irọ́ ni. But téèyàn wá lògùn dáadáa, téèyàn wá sì ṣe gbogbo nǹkan tó jẹ́ kí èèyàn máa wà ní ìlera tó péye, gbogbo kinní ló lè fẹ́ máa mẹ́ẹ̀ ní ọ̀nà kan tàbí òmíràn. A sì rí pé gbogbo eléyìí ó máa jẹ́ kí doctor yín lè advice yín pé ok, ẹ tètè máa sùn ní o, ẹ má jẹun tó bá ti di aago 8 o, omi nìkan kẹ́ mú o, báyìí àti báyìí ló yẹ kẹ́ ṣe máa ṣe o. And gbogbo kinní máa jẹ́ kẹ́ wà ní kí ọkàn yín balẹ̀. So what I'm trying to say is that we've already highlighted many benefits, 5 benefits actually, of having a constant and consistent medical checkup. And the first thing is it gives rise to you being able to detect illnesses early and intervene. That's early detection and intervention. It also helps to prevent counseling, to give you preventive counseling, I beg your pardon, to give you preventive counseling and education on how to promote your health. And also it helps you to monitor and manage chronic conditions and know what to do. Then the fourth one is it gives holistic health assessment. You look at the physical, the mental, and the social being of the person, and this subsequently gives peace of mind and reassurance to you as a person and also to your health status. So what are the common medical checkups that can be done? That's what we'll be discussing. So I'll be discussing it explicitly, and I would like you to listen to it and take it in and utilize the information. So technology has evolved, yes, and it can allow you to check every organ system and evaluate them efficiently. However, the commonest ailment and system affectations is what we as doctors usually examine first. We usually say first things occur commonly and common things occur commonly. That is, common things are what you see. So we first screen for the common things before we go for the uncommon things. And we start with the first thing, which is medical examination, where you get your anthropometry, we get your weight, you get your height, and subsequently your body mass index. And this is just we get your waist circumference, your hip circumference, and just to evaluate you for obesity, because obesity has been known to be a cause of many chronic illnesses and even sudden deaths in some people. And we also check your blood pressure, your pulse rate, your heart rate, just to make sure that all what we call vital signs are essentially normal. And also your anthropometry, you are not too fat, you are not, you are of optimum weight. And also the next thing we do is diabetes profile, where we do fasting blood sugar to know, after you fasted overnight, we know your blood sugar level and we are able to effectively evaluate it. Then also for people that they are non-diabetic or people that don't even know their health status, they're having one complaint or the other, we do what we call hemoglobin A1C, which is glycated hemoglobin, and this evaluates your blood sugar control over 3 months. That is, the lifestyle of a red blood cell is about 3 months. So you will see that what has been the pattern of your blood sugar control in 3 months. And also we now do a test to assess for your fats and oil retention, and this is what we call the lipid profile, where we check your cholesterol level, your triglyceride, your lipoprotein, all within your bloodstream, to know that okay, this blood lipid, this cholesterol, they are within the normal range. Then we also do what we call infection screening. This is the one many people are always afraid of. For example, all these retroviral screening for tests for HIV and AIDS, hepatitis and screening, hepatitis B, hepatitis C, stool analysis for parasites, for infective organisms, and this is where most people will be having heartbeats that are pulsating. But we usually calm people down, we counsel them before we go ahead with these investigations. Then also the fifth thing you should do is to monitor your heart health. Your heart is a vital organ of your body. Without your heart beating, trust me, you won't be listening to me right now. So for you to evaluate your heart, you need what we call ECG, electrocardiogram, and this tests your electrical activities. And know that the electrical activities is just like wiring of a house. If you test the wiring of a house, you know how functional the house is. Then also we do what we call echocardiogram, which evaluates the structural and functional aspects of the heart. They look at your heart through one very special pen-like ultrasound probe, and they look at all the chambers of the heart, how the heart is beating. Are there vegetations? Is there a hole in the heart? They see all that just from a non-invasive. They are not even giving injection of anything. They are just rubbing something like a cream on your chest and checking all the chambers of your heart. So the sixth thing that we should do, of course, I've spoken about that briefly, is your liver profile. Yes, besides hepatitis, there are things like fatty liver that can affect liver, alcoholic liver disease, and all these liver function tests will help to test all the liver enzymes and proteins that are produced in the liver, and it will help to evaluate how functional that liver is. Then also your kidney function test. Yes, we've always heard of kidney failure here, kidney failure there, and just doing basic things like your electrolyte, your urea, your creatinine, your urea, your uric acid, your calcium, your urinalysis, something as basic as just peeing in a bottle, and they are checking it with something we call a strip, will help to test how efficiently your kidneys are removing waste products through urine. All these tests I've mentioned earlier, the creatinine will help to know, is it filtering very well? Are the functional elements, which are the electrolytes, are they essentially normal within the normal range? And how does it have a great balance? And you are not retaining excess weight, you are not losing essential elements in your body. This is what all those kidney function tests will do for you. And the 18 is a thyroid profile. Yes, we know that through triiodothyronine, that's T3, thyroxine, T4, and thyroid stimulating hormone, you can characterize the build up and breakdown of energy in the body. This is what we call catabolism. We know how well you are digesting, how well your heart rates, all those things function through your thyroid hormones, and we are able to evaluate it. Then also cancer screening. I'll take a pause here. Cancer screening. Many people are coming down with cancer because once they are 40 years and above, they just say, what have we not seen? No. You should get something. As a male, you should know your prostate specific antigen, which we call PSA. It's important. As a female, you should do a papillomacular smear, which we call pap smear. And also, you should do that pap smear helps to assess for cervical cancer. You should do CT, which can say, oh, it's a liver cancer, a lung cancer, colorectal cancer, endometrial cancer, or breast cancer hidden somewhere, or carcinoembryonic antigen, which will say, oh, is there a thyroid cancer, is there a rectal cancer, is there a stomach cancer, a pancreas cancer, or an ovarian cancer hidden somewhere. All these things are essential for your body. And also, this cancer screening are vital, that it doesn't even have to be something that has started to grow. It is showing signs that it is hidden somewhere. We call some kind of cancers hidden cancers. So all this cancer screening will quickly pick up the blood levels of all those cancer discharges in your body, and you are able to quickly screen and identify which organ wants to go aberrant. And you should also get radiological and ultrasound screening done. These are all the necessary to know, is there tuberculosis, is there bronchitis, thoracolumbar spine, if you know you have a back pain, maybe to rule out kyphosis, scoliosis, or spondylosis. An abdominal scan to know, is there a fatty liver, do you have kidney stones, do you have fibroid. And also prostate scan, is there prostate scan, is there prostate enlargement, is there prostate cancer somewhere. Breast scan to know, is there a breast lump, a breast cancer. And mammography for women, especially women above the 40 years age group, because we know breast cancer is a common cause of death in women above 40 years, and even we are seeing it in younger adults these days. And we will now wrap everything up with a full blood count, where you know, oh, this is what my blood level is. Oh, I'm not anemic. Do your blood genotype if you are not so sure. Are you AA? Are you AC? Are you SS? Are you SC? Or their derivatives? You do your blood group. Oh, and this is so important for all this wedding screening. And we want to eradicate the SS. This thing is not really eradicate we want to a society that is sickle cell free. Is still what we are aiming at. So AS, marrying AS is not advisable. There should be a genetic screening that should have said that, oh, this person is AS, this person is AS. There's no need to gamble and put the life of the child at risk. It's better someone dissolves that kind of relationship. And all these things are vital, and they are helpful for us as a people. So let me take that again. The test you should do, I have 11 different tests, and the first one is you should have a medical examination where you do all the blood pressure, your weight, your height, and all that. You should do a diabetic profile where you do your blood sugar levels. You should do a lipid profile. You should screen for infections. The fifth one, you should check your heart health, your liver. Then you should do your liver health. You should know your kidney health, your thyroid health. You should screen for cancers. You should screen for radiological, maybe all these tuberculosis and all those chronic cough, causes of chronic cough. And then you wrap it up with blood workup, where you do your full blood count, and also you do your genotype and blood group. And it is essential that we should know our numbers. Yes, there's a common saying that, do you know your numbers? And what do I mean by this? Knowing your blood pressure per time, knowing your sugar level per time, knowing your weight per time, and knowing your BMI. Are you above 30 kilogram per meter square? You're already obese. And there are ways you can even cut down on your weight without necessarily having to go on crash dieting. There are healthier ways to lose weight, and your doctors will be able to advise you on this. So nǹkan tí mo ń sọ fún yín ni pé oríṣiríṣi àyẹ̀wò ló wà tá lè máa ṣe lóòrèkóòrè, at least ká tiẹ̀ ṣe lẹ́ẹ̀kan ní ọdún kan ká bá lè mọ ètò ìlera wa tó ṣe rí, tí ara wa ṣe wà ní ìlera ara. Kàn ṣẹ́ẹ̀kì ìwọ̀n wa, tá ṣe ga sí ni o, ìfúnpá wa, kàn ṣẹ́ẹ̀kì bóyá nítọ̀ ṣúgà bá nítọ̀ ṣúgà, kàn ṣẹ́ẹ̀kì ọ̀rá inú ẹ̀jẹ̀, kàn ṣẹ́ẹ̀kì pé ṣé infection kankan bí kòkòrò HIV ṣé ó wà lára èèyàn àbí jẹ̀dọ̀jẹ̀dọ̀ wà lára èèyàn. Kéèyàn ṣẹ́ẹ̀kì gbogbo nǹkan tó jẹ mọ́ àìsàn ọkàn, kéèyàn ṣẹ́ẹ̀kì gbogbo nǹkan tó jẹ mọ́ ẹ̀dọ̀, kéèyàn ṣẹ́ẹ̀kì nǹkan tó jẹ mọ́ kíndìnrín, kéèyàn ṣẹ́ẹ̀kì gbogbo nǹkan tó jẹ mọ́ èèyàn nígbẹ̀gbẹ̀ lọ́rùn ni o, àbí kéèyàn ṣẹ́ẹ̀kì gbogbo nǹkan tó jẹ mọ́ jẹjẹrẹ, because a ti ń rí i pé púpọ̀ nínú àwọn tó ń gbé ní lágbègbè wa bóyá oúnjẹ ló ń fà á ni o, bóyá àìsàn yìí kàn ń fò káàkiri ni. A ṣàmọ̀ yìí pé pẹ̀lú gbogbo oúnjẹ táwọn èèyàn ń jẹ ń sìn, pẹ̀lú gbogbo radiation káàkiri àwọn èèyàn tó ní jẹjẹrẹ wọ́n ti ń pọ̀ sí. A sì rí i pé gbogbo nǹkan tó jẹ mọ́ PSA, gbogbo nǹkan tó jẹ mọ́ C-reactive protein, gbogbo nǹkan tó jẹ mọ́ èèyàn ń ṣe pap smear ni o, gbogbo kinní yìí ló ń jẹ́ ká mọ̀ pé jẹjẹrẹ ti fẹ́ bẹ̀rẹ̀, ẹja tètè wádìí ibi tó ti fẹ́ bẹ̀rẹ̀ ká sì tètè fún ní ìtọ́jú tí ò ní jẹ́ pé irú nǹkan báyìí ó ń jẹ́ kéèyàn papòdà. Ká sì ṣe gbogbo nǹkan tó jẹ mọ́ x-ray àyà ni o, x-ray ẹ̀yìn ni o, ká bàa lè mọ̀ pé egungun ó sì dúró dáadáa, èèyàn ò ní ikọ́ ọ̀fẹ́, irú nǹkan bẹ́ẹ̀ yẹn. A máa kó gbogbo ẹ̀ papọ̀, a máa ṣe tẹ́sítì ìwọ̀n ẹ̀jẹ̀ wa, a máa mọ genotype wa. Gbogbo kíní ṣe kókó, ó sì ṣe pàtàkì fún ìgbé ayé àlàáfíà, ìgbé ayé ìlera. So mi ì ní fi yín lẹ̀ láì sọ nǹkan tẹ́ ẹ lè ṣe nísìn tẹ́ ti gbọ́ mi, nǹkan tẹ́ lè múlò, tẹ́ lè lò, tẹ́ lè ṣe pé nǹkan báyìí ló yẹ kí n máa ṣe. A mọ̀ pé nǹkan wọ́n, wá sì mọ̀ pé ìlera gangan òun ni ọrọ̀, ìlera òun lọ́rọ̀. So we'll be discussing on your role as a person and role of stakeholders in promoting preventive care. So as an individual, you bear the primary responsibility for prioritizing your health and seeking preventive care. This you do by scheduling regular medical checkups, by adhering to recommended screenings and vaccinations, and by adopting healthy lifestyle behavior. And this you will do proactively to safeguard your well-being and reduce the risk of preventable illness. So it always starts with you. Yes, dear listener, it starts with you. Then we will talk about the health organizations. The health organizations like the hospitals, the clinics, the community health centers, they also play a pivotal role in promoting preventive care. They offer comprehensive medical checkup services. They implement reminder systems for screening. They keep telling you, you've not come for your blood test this month. They keep checking up on you to be sure you're in good health. And they conduct outreach programs to underserved communities. There's a community that have eye issues. There's a community that there's cholera. They go out there to help to conduct outreaches to them, the underserved, the abandoned. They are the ones that all these outreaches are usually targeted towards. And anytime there's an outreach, please be very sensitive to how well you implement it, because that is just a free healthcare for you. Why not just go take a very good wrap up of, they are taking blood pressure. Check your blood pressure. They are checking your BP, your sugar. Go check it up. And this can help to promote all your health. And what does the government have to do? We are begging the government, and we are also advising the government that there are policies that shape the well-being of the country. So policies that promote public health awareness, that promote preventive care initiatives, and they should fund and support these preventive services. They should implement it on the population. That there should be wide screening program for all these cancers we are seeing. There should be wide screening program for hepatitis. In fact, there was a time I was working in a government hospital and I was seeing the rate at which pregnant women were hepatitis positive. This is highly preventable through vaccines, just through vaccines. There should be a lot of free vaccines during the World Hepatitis Day. There should be all these things to sensitize people as well as to make them capable of taking their health seriously, and also providing subsidized services for underserved communities, and make sure that all these primary centers are helpful and also aiding people to get good medical services at their doorstep. And also we are also urging healthcare professionals and providers just like me that we should serve as trusted allies in promoting preventive care and facilitating medical checkups. And we can do this by a strong doctor-patient relationship, conducting thorough assessment, and offering personalized recommendations. Don't just be general in your in all the policies or all the healthcare. See every patient as individuals and provide empowering information that can take them through proactive steps of getting better health outcomes. So nǹkan tí mo ń sọ ni pé ọ̀nà mẹ́rin la máa wo nǹkan tí a lè ṣe. A kò lè sọ pé báyìí ló ṣe ń lọ, ká má sọ pé nǹkan báyìí ló yẹ ká ṣe. Gẹ́gẹ́ bí ẹlẹ́ran ara, a mọ̀ pé ìlera wa àwa ló gbọ́dọ̀ jẹ́ lógún jù. Ẹ má fi ìlera yín, ẹ má fi ọwọ́ yẹpẹrẹ mú rárá àti rárá. Kẹ́ make sure pé torí at least ẹ̀ẹ̀mejì ní ọdún kan ẹ lọ rí doctor yín. Any complain o, ẹ kàn lọ rí doctor yín pé okay o, báyìí ni ara mi ṣe ń ṣe o, báyìí dẹ̀ ayé ẹ̀dẹ̀ rí pé at least lẹ́ẹ̀kan ní ọdún yẹn wọ́n chẹ́kì gbogbo ìfúnpá yín ni o, gbogbo ọ̀rá inú ẹ̀jẹ̀ ni o, wọ́n chẹ́kì bóyá ẹ ní ìtọ̀ ṣúgà. Gbogbo kíní yìí ó jẹ́ nǹkan tó tẹ́ gbọ́dọ̀ mú lọ́kùnkúndùn, nǹkan tẹ́ gbọ́dọ̀ ṣe pé ìlera mi ó gbọ́dọ̀ jẹ mí lógún. A sì rí pé gbogbo àwọn elétò ìlera, gbogbo àwọn hospital yẹn agbègbè wọn wọ́n wà kí wọ́n sì máa ṣe pé gbogbo àwọn tí agbára wọn ò lè gbé láti ṣe àwọn test kan kó máa ràn wọ́n lọ́wọ́ pẹ̀lú wípé wọ́n polongo free health care. Wọ́n gbé lọ agbègbè kan tí wọ́n lágbára láti wá sí hospital. Wọ́n ṣe lè láti rí pé gbogbo àwa tá wà ní orílẹ̀-èdè wa a jẹ́ ẹni tí ìlera wa kó múnádóko dáadáa. A sì rí pé àwọn ìjọba náà ní ìgbésẹ̀ tí wọ́n gbọ́dọ̀ máa gbé. Gbogbo òfin wípé gbogbo primary health center ni o, kàn bá wa ṣe policy tó jẹ́ pé gbogbo owó wọn kò ga ju ara wa lọ. Gbogbo owó wípé ẹ̀ ń ṣe kíní, ẹ̀ ń ṣe test yìí, gbogbo èròjà, gbogbo kíní test ni o, gbogbo equipment ni o, gbogbo irinṣẹ́ tí wọ́n gbọ́dọ̀ lò láti jẹ́ kí àwọn tó wà lágbègbè yẹn kán wà ní ìlera ara, kán túbọ̀ kán máa bá wa gbé kalẹ̀, kán máa support àwọn community tí ó lè afford ẹ̀. Kó sì jẹ́ pé gbogbo hospital tí kò ń ṣe elétò ìlera lónìí kán wá kán fi bá wa ṣe pé gbogbo wọ́n á di àtìpá. Wípé quality health, quality clinic, quality medical practitioners ni àwọn tí ó ń ṣiṣẹ́, àwọn tí ó sì ń jẹ́ kí gbogbo àwọn tó wà ní gbogbo agbègbè wa kó máa attend sí wa. So àwa gẹ́gẹ́ bí onímọ̀ ṣègùn òyìnbó, àwa gẹ́gẹ́ bí dókítà náà ká ṣe rí pé gbogbo nǹkan tá à ń ṣe fún àwọn patient wa, gbogbo àwọn tó wá gba ìtọ́jú, ó jẹ́ nǹkan tí ó ń sún wọn sí ìlera. Ká bá wọn sọ̀rọ̀, ká bá wọn jíròrò, ṣe báyìí, ká túbọ̀ wọ́n sọ pé àwọn èèyàn jápa, àwọn tí ò tí ì jápa, ẹ jẹ́ kí wọ́n túbọ̀ kàn máa ṣe gbogbo nǹkan tó jẹ mọ́ ìlera agbègbè, ìlera àwọn tó wà ní orílẹ̀-èdè Nàìjíríà, orílẹ̀-èdè kan tí ń gbọ́ mi báyìí, a máa rí i pé gbogbo kinní yìí la mú ní ọ̀kúnkúndùn. So medical check-up stand as the beacon of preventive care and illuminating pathways to wellness, longevity, and vitality. As individuals, as health organizations, and as governmental agencies, we should join hands in championing preventive care initiatives. We should support preventive care. We should pave the way for a healthier and more resilient society. And let us embrace the power of medical checkup as catalyst for this change. We should nurture a culture of proactive health management and collective well-being for generations to come. You know, I don't leave you on this show without telling you a quote. So this is a quote from Thomas Edison. It says, "The doctor of the future will give no medication, but will interest his patients in the care of the human frame, diet, and in the cause and prevention of diseases." I take that again. The doctor of the future will give no medication, but will interest his patients in the care of the human frame, diet, and in the cause and prevention of disease. Nǹkan tí eléyìí sọ fún wa ni pé àwọn dókítà wá ń sìn kò ń ṣe gbogbo àwọn máa kọ̀gùn fún wa, gbogbo nǹkan tó pé ẹ ṣe báyìí, gbogbo eléyìí náà ló ń túbọ̀ sún wa sí ìlera ara. So on that note, as we wrap up another enlightening episode of The Radio Doctor, I want to thank you for tuning in and exploring the world of health and medicine with me. And remember, knowledge is power, and by staying informed, you can make better decisions for your well-being. Don't forget to follow us on our social media for updates and to continue the conversation there on Facebook, on Instagram, on X, and we are at Wells Radio 89.3 FM for our listeners outside of Ibadan or in diaspora. You can also be a part of the show by listening live through our website www.wellsradio89.3.com. And remember, if you have any health concern you would like for us to discuss, please reach out to us via our email wellsradiodoctor@gmail.com or via WhatsApp through 091-5499-9893. I take that again. You can send us a WhatsApp message on 091-5499-9893 or send us an email on wellsradiodoctor@gmail.com, and rest assured that we will properly examine your thoughts and your health concerns. Until next time, I'm Dr. Tobiloba Ojo, aka Daddy Ojo, and stay healthy and keep listening to The Radio Doctor. God bless you.